Hello students. Today we'll talk about inspiration on chest x-ray. Whenever you are describing any chest x-ray, you should always describe whether it is in full inspiration, whether it is adequate, whether that chest x-ray is adequate or that chest x-ray is not adequate. For adequacy of a chest x-ray, how we can assess that? Just a minute. For adequacy of a chest x-ray, we should see 3 points. First one is inspiration. Today we are going to talk about this. Second one is rotation. We have talked about this in a different video. You can go and see that. Third one is penetration. As you all know, we are using now digital X-ray radiography. So whether a X-ray is under penetrated or over penetrated, we can manually improve that. Okay. Now we'll come to our today's topic of this video, inspiration. How does this inspiration affect, whether this inspiration even matters, okay? And if it matters, how to assess that inspiration on a chest x-ray? First of all, we'll come to the point how to assess inspiration. For adequate inspiration, we must see anterior ends of at least 6 ribs above left hemi-diaphragm. And if we are seeing posterior ends, then how many posterior ends, then how many ribs we should see? Then the count increases to 10. Now we'll see how to see these ribs. So this is the anterior end. 1, 2, 3, 4, 5, 6, 7. So this X-ray is adequate. This X-ray is adequate, taken on a adequate inspiration. And how do we achieve this adequate inspiration? We usually ask the patient to deeply inhale and hold that breath. Okay? The X-ray is taken, the X-ray, PA chest X-ray, whatever we take PA chest X-ray in a standard technique. We ask the patient to fully inspire and hold that breath while we give the exposure. Okay? Now we'll come to the posterior ends. Posterior ends, these are the posterior ends. This, 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 here, this, and this. Okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay? And one more here. So this is adequate inspiration. Okay? Now we'll come to the point, how does it even matter? And we'll also assess this. We'll count the ribs over here. This is the first anterior rib. 1, 2, 3, 4, and 5. Okay? We are seeing 5 anterior ends. Okay? not adequate. How does it even matter? ठीक है, we'll come to the points. First of all, you can see that there is cardiomegaly in a not well inspirated film. We'll talk about this in detail now. As you all know, this is the dome of the diaphragm. This is the dome of the diaphragm. The under surface of heart. The under surface of the heart is usually attached to these dome of the diaphragms. Whenever patient inspires, inadequate inspiration, diaphragm contracts and pulls down the heart. What will this do? This will decrease the transverse thoracic diameter. ठीक है, बिकॉज ऑफ दिस थिंग अगर इंस्पिरेशन एडिक्वेट नहीं होगा, what will happen? This diaphragm is not going to contract adequately. The heart will not be pulled down and it will lead to increase in cardiac diameter. Transverse cardiac diameter. It will lead to increase transverse cardiac diameter, and what it will cause? It will cause cardiomegaly, and that cardiomegaly would be apparent. It will not be true cardiomegaly, it would be apparent cardiomegaly. ठीक है, then what is the second point? First of all, we have discussed this cardiomegaly. Not adequate inspiration what will it do? It will not allow lungs to expand fully. Then what will happen? We'll see crowding of vessels on lung bases. अब वेसल्स तो नॉर्मली भी होती है वहाँ पे, लेकिन बिकॉज ऑफ डिक्रीज इन एक्सपेंशन this crowding will result into, what will it do? It will mimic basal infection or subsegmental collapse. As we all know that crowding of vessels is a indirect sign of collapse. We'll discuss this in some other video where we'll talk about the lung collapse, the features of lung collapse. Today we have discussed inspiration on a chest x-ray. ठीक है, how to assess inspiration on if we are counting the anterior ends of the ribs, at least 6 ribs we should count above the left hemidiaphragm. If we are counting posterior, then the count raises to 10. So this is adequate inspiration. This X-ray not adequate inspiration. If a X-ray is not taken in adequate inspiration, what will it result into? It will cause spurious cardiomegaly. ठीक है, sorry for my mistake here. And second, it will mimic basal infection or subsegmental collapse. And this pathology is also apparent because it is not existing in real time. It is not present. It is apparent. ठीक है. Thank you for your patient listening.